Welcome to the Back Talk Podcast, where we talk about your back so it doesn't talk back to you. Hosted by Dr. Peter Peduzzi, Clinic Director at American Back Centers. Each episode explores real solutions for back pain using non-invasive, non-surgical care designed to help you avoid spinal surgery. Helping people throughout the greater Pittsburgh area feel better naturally, without the hardware or the drama.
Today, we're breaking down how Invisa-RED works and why reducing excess weight can make a major difference for spinal health. Welcome, everyone. I'm Julie Schwenzer, co-host and producer with Dr. Peter Peduzzi, the clinic director at American Back Centers. Dr. Peduzzi, thanks again for joining us.
Thank you for having me. I'm really excited to talk about the Invisa-RED today. It's been amazing here at our office here.
Oh yeah, I can't wait to hear more about this. So, how does Invisa-RED therapy support weight loss and reduce strain on the spine?
Invisa-RED is just remarkable. They do call it Invisa-RED, and it is confused with red light therapy. It is not red light. It's actually a laser. If you look at the research with red light's very superficial. It's hitting the top layer of the skin per se, whereas our treatment with the dual coherent pulse lasers penetrates much deeper through the epidermis, dermis, all the way into the fat. So we actually can dissolve those fat cells. Also, you're burning the equivalent of 1,700 calories every session with Invisa-RED. So it's pretty remarkable. So you're getting that caloric deficit, plus you're getting the individual areas that you want. So we're getting weight loss, fat loss, and inch loss, all three, not just weight loss.
Yeah, and can you explain more about how the technology stimulates the fat loss at the cellular level?
Well, number one, it's getting there. Unlike the red light therapy, and I'm not knocking red light, it's getting into the fat cells as opposed to just getting to the superficial skin. And it's burning those fat cells and dissolving them. We have a whole process with the vibration therapy that helps to stimulate the lymphatic system to push it out of the body. But it's documented. We'll have patients come in for a sample treatment and they'll lose an inch with one session. It's pretty amazing. So when they go through the treatment session, typically it's 12 to 24 treatments, they're losing a remarkable amount of inches and fat in the areas they want. Because, it's not hard to lose weight, but you don't lose it where you want. So we can really pinpoint those areas, tighten the skin. There's even stretch mark removal that we'll see as it's stimulating those collagen fibers, where stretch marks will be diminished. That saggy skin that you get when you do lose weight, the laser actually tightens that up. So you're actually getting, again, that inch loss, fat loss, not just weight loss.
Yeah, like you just mentioned, I mean, the target area for so many people, the belly. It's so hard to lose weight in that area, especially as you
Mhm.
get older with the cortisol
Yeah,
levels and the stress,
yeah.
so do people come in and they literally need like a smaller pair of pants when they walk out? Because an inch can be
Well, I
quite a
mean, they
bit.
do, yeah, and like I said, even in one treatment, they notice results, and, we can do a number of different areas. We have an intro video when they come in, it shows them they can do their arms, they can do the front and back of their thighs, their butt, even the chin and neck can be, addressed with this treatment. But yes, the majority of the people are gonna do the abdominal region, for sure.
And how do you feel after it? Like what do patients say about the actual like feelings they have physically?
Well, if I can say before the treat or during the treatment, I should say, they feel a little bit of heat. We do require that they wear goggles to protect their eyes, and then afterwards, I mean, most patients will see. I mean, they're happy. They see the results immediately, and we have as far as how they feel, they just feel better because they look better in the mirror for sure.
And then how do you go about, the follow-ups and then, checking on them to see if maybe they also complemented the treatment with lifestyle changes?
I mean, we actually have a diet. They actually have an app. Invisired has an app that they download on their phone. Their 60-day diet, which is totally optional. We actually have three homeopathics that go along with it as well that they take during the Invisired sessions. The one is very similar to a natural, I guess I call it a natural Ozempic, because basically Ozempic is just an appetite suppressant. And we know Ozempic has a lot of side effects, vision, kidney damage, liver damage. We don't have any of that with these products. They're all natural. They're extremely effective. And we're seeing, again, weight loss, inch loss, and fat loss, all three. And really no weight loss system can claim that, all three of those.
And like you mentioned too, I mean, they're happier because of the results, like, it seems instantly.
Uh-huh.
Do you think that also helps a lot of the patients? Like, this is quite a motivation to make certain changes or to keep going in
Yeah,
that
I mean,
direction.
they're changing. Obviously, they're changing their diet with the program too, but also we're removing that visceral fat, the fat around their organs, which is extremely important. A lot of people talk about BMI, but BMI is not a great indicator of health. I tell we're here in Pittsburgh, obviously, so I'll tell patients, the Pittsburgh Steelers, every single one of them have a high BMI because they have a lot of muscle. So it's based entirely on weight. We're looking more at reducing their body fat percentage and that fat around the viscera and so on, and we see that. So we take a measurement in addition to the inches, we also take a measurement of their body fat percentage before and after treatment, and people are seeing remarkable reduction in body fat as well, percentage.
Yeah. Yes. And then how does reducing that extra weight impact the spinal pressure and then the overall back? I imagine there's some
Oh,
relief there.
yeah, I mean, obviously, when you're taking those pounds, that weight off your spine, it's gonna take pressure off your knees, your hips, everywhere in your body. All your joints in your body are gonna do much, much better because there's less weight bearing on those joints.
And then I know you touched on this, but like, how do you make sure somebody is qualified to use this treatment, or what could limit them from or restrict them from using it?
Well, very similar. I mean, we're looking for any contraindications. Namely, the big ones are if someone has a pacemaker, defibrillator, we can't do the laser. Now, they can do the weight loss program, the diet, and the drops, but they can't do the laser. If a woman was pregnant, obviously, we would not want to do the laser, especially in the abdominal region. And there's other contraindications as well, active cancer. We have a whole list. We have a screening process when they come in, but the majority of the patients that come in are good candidates for the laser treatment.
And you do refer to this as therapy, right? You said that.
Oh, yeah. Yeah, I mean, obviously, yeah, it's a form of therapy because you are getting a reduction. Now it's an aesthetic therapy, right? So, I mean, you were getting aesthetic results there, inch loss, fat loss, weight loss. But, indirectly, we can help their joints of their body too by helping them lose weight and that wear and tear on the joints.
And who could be the best candidates for an Invisa-RED? It seems like there could be many.
I mean, really anybody. I mean, I don't know anyone that doesn't have issues with need for inch loss or fat loss. I mean, we have patients come in here that are not overweight by any means, but again, they have that area, the stomach region, arms, thighs, a little bit of jiggle per se, and everyone, anybody would be a good candidate for this treatment.
And then I know you did touch on this as well, but when somebody walks in and does this, like, what do you actually go through? You put on the goggles, you got to put a gown on, like, how does it all work? Fill out some paperwork?
Yeah, so after we clear them and we feel that they're, good for the treatment, there's no contraindications, we obviously would put them into the room. We take measurements first. We take the body fat percentage. We take the measurements and measurement above and below the belly button for the abdominal region if we're doing that region. And then we put them on the treatment. They're typically only here for 15 minutes for the laser session. And then they will go out into the open therapy room and get onto the vibration platform, which again helps to stimulate the lymphatic system. And they're there for about 10 minutes and then they're out. So, for the most part, it's very convenient. People are here less than 30 minutes when they come in for sessions and they're in and out and they're very happy because they can get on with their day.
Oh yeah, that sounds great. um, yeah, and then is this something my last question to you is this something that you frequently have sessions for every week? Is this one of the more requested therapies?
Yeah, I mean, we've started doing this a little over a year ago, and it's just taken off. I mean, we have our current patients, asking about it and asking how they can do it, and then we obviously, do word of mouth and advertising as well. And we get regular patients coming in. They love it because it's safe, effective, and doesn't have the side effects that some of these, prescription weight loss pills have.
Okay, well, that was great, Dr. Peduzzi. I mean, you shared a lot of helpful insights, and we appreciate you and what this therapy is doing for so many people.
Well, thank you so much.
Thanks for listening to the Back Talk Podcast. If back pain is slowing you down or bossing you around, it may be time for a natural approach that works. Call 724-935-3300 to schedule a consultation with one of the doctors at American Back Centers, or visit AmericanBackCenters.com.
At American Back Centers, you've got nothing to lose but the pain.